Has this ever happened to you just when you least expect or want it? Back pain. Back injuries cost you and your employer time and money. Many hours at work, home, and play are lost to bad backs. It's estimated that 8 out of 10 Americans will have a back injury at some point throughout their lives. And yet, preventing back injury can be as simple as learning proper lifting, strengthening neglected muscles, and applying good body mechanics at work, home, and play.
LIFT, the Low Back Institute for Training, presents a comprehensive low back education video to teach everyone how to have and keep a healthy back. And now let's join Gary.
There's no doubt in my mind that you've all seen pamphlets, brochures, and demonstrations on proper body mechanics. There's always someone telling us how to do something. But today, we're not only going to talk to you about proper lifting and bending, we're going to show you, through the magic of video, exactly how it's done. Hi, I'm Gary Lindhal, and as a physical therapist for over 26 years, I've seen my share of back injuries occurring both on and off the job. Unfortunately, the majority of these injuries happen where you are right now, at work. The sad thing is that most all these injuries could have been avoided had proper bending and lifting techniques been taught to and applied by the employee. But in addition to their responsibility, you also have a responsibility to protect your back. After all, if you do get hurt, someone just might ask you if you've seen this tape and if you've used correct body mechanics. You can be well assured that your employer does not want you to have a low back injury. And I can assure you that you don't want to go through all the suffering and pain and problems that can develop from having a low back injury. So for the next few moments, sit back, hopefully in a good, straight, comfortable position, and we'll do the best we can to teach you proper body mechanics. But before we get into the details, let's begin with a little anatomy. How about Back Anatomy 101? Ever since the creation of man, our low back has suffered. Humans just don't have the structural advantage of walking on all fours, and therefore our low back must bear the brunt of our body's weight. In addition, the low back has inherited the ever-increasing stress of daily living, poor posture, lack of exercise, overeating, and the abuse of improper lifting, bending, stooping, twisting, pushing, and pulling. There are 3 natural curves in your back which help keep it aligned. Your low back is the lumbar curve, consisting of 5 vertebrae with their associated discs, nerve roots, ligaments, muscles, and tendons. These are the largest and have the greatest load to bear. Your middle back is the thoracic curve, which has 12 vertebrae. Your neck is a cervical curve consisting of 7 vertebrae. In all, you have 24 vertebrae supporting your back. Vertebrae are the bones of your spine. They are connected to each other by ligaments and interlocking joints called facets. In between the vertebrae are discs, which act as shock absorbers because they cushion your spine and keep your vertebrae evenly spaced. Disc structure is very strong around the outside edges with very fibrous ligamentous material. The center consists of a fluid nucleus which moves back and forth in the spine. As you bend forward, the nucleus goes backwards. This presses it against the posterior back wall of the disc, which is the weakest portion.